Hello, everyone. Welcome. A big welcome to all the participants of the LRI Spring Meeting. Welcome. My name is Linda Hummel. I'm the Director of Leprosy Research Initiative, and it's my huge pleasure to say this word of welcome to all of you at the start of the LRI Spring Meeting in 2025. And I'd like to welcome you on behalf of LRI's partners, because the Leprosy Research Initiative is a unique joint initiative started by partners. They are the backbone of this initiative, and they started it over 10 years ago and continue it into the future. And that is something that I think we cannot appreciate enough, because it's brought change to the world of leprosy research. So at this online LRI Spring Meeting, we expect over 250 attendees from 50 countries to come together, which I find really exciting. It's the advantage of being online. And it's a very important event for presenting and discussing progress and results from your LRI-funded research projects. But it's also an important moment to reach out across the globe virtually, to reach the talented and committed people, and also to connect around our shared purpose of ending leprosy. So we expect not only the researchers, but also attendees from universities, from research institutes, from ministries of health, from pharmaceutical companies, staff from the partner organizations, people from the Global Partnership for Zero Leprosy, WHO representatives, EDCTP representatives, and of course, organizations representing persons affected by leprosy. And this is all very significant, because the research that's happening should inform policy and should inform practice. The evidence of the work that's being done is to be used to better support persons affected by leprosy. So a warm welcome to all of those that can apply the research results of this meeting. Now I'd like to give the word to Dr. Richard Truman, Chair of the Scientific Review Committee. Welcome, Dick, to you, and I wish you a very good meeting. The word's to you.
Thank you very much. So I'm Richard Truman, Chair of the Scientific Review Committee at the LRI. We hold this session annually, these spring meetings. They're principally intended as an opportunity to showcase the talent that we have within our LRI grantees, and also to encourage collaboration and exchange between our audience and developing scientists along the way. For the next 2 days, we will have sessions that really cover the gamut of leprosy. So there is something here for everybody. And we encourage you to take part in as many sessions as you possibly can, and to be open and maybe learn a little bit more about areas that you're less familiar with as well. Let me also encourage you to have any questions as we go along, to enter those within the chat. And when you do so, at the end of the presentation, the presenters will do their best as time allows to respond to your questions. And those that they don't get to at that point in time, we'll share with the presenter, and they can answer them offline to the individual submitting. So that being the case, we have for today our keynote opening speaker, Dr. Subbanna Jonnalagada, to tell us about the latest developments in the Global Leprosy Program at the WHO.
Hello. Thank you, Dr. Truman and Linda, for your kind words of introduction. Yeah. And I take this opportunity to thank LRI organizers to give us this opportunity to present before the LRI online delegates. Yeah, greetings from WHO GLP. So I just want to provide you the latest developments in Global Leprosy Program during the past 1 year. So my presentation has got 3 parts. Initially, I'll be talking briefly about the global leprosy updates followed by the new digital tools introduced by GLP. And towards the end, I'll give just a snapshot of the guidelines development. So as you're all aware, WHO GLP compiles all the information from all the countries across the globe every year and publishes it in the weekly epidemiological record in September every year. And this is the latest information what we have published is in September 2024, which is data of 2023. So we have published this data in September, and also we have updated the data of 2023 into the Global Health GHO database. So I'm glad to inform that 184 countries and territories out of 221 have reported cases into the DHS, and this is across all the 6 WHO regions and 23 global priority countries. So increasing reporting has been done compared to the previous years. So as you see, compared to 2019 onwards, there's been increasing reporting, and we are glad to inform that Eastern Mediterranean region as well as Southeast Asia region, all the countries have reported it's 100% reporting, but we are to catch up with the Euro region as well as Wipro region. And in the pie chart, you can see that the major contributor, the major burden of leprosy among the new cases is still Southeast Asia region, which represents 72% of the new case burden of leprosy, followed by the Americas and Afro. So the reporting pattern is here, and this is the reporting how we have received across the globe. It's a geographical representation. So we are glad to inform that 56 countries have reported 0 new cases during 2023, and less than 10 cases, there are 47 countries which have reported. So this is heartening to see this trend. And we have to also look at, there are 3 bigger countries, that is India, Indonesia, and Brazil, which still contribute more than 10,000 cases, which is concerning. At the same time, a lot of actions have to be taken at the ground level. And Switzerland is the only country which have reported no data available. So as you know, because of COVID, the general health systems were focused on addressing the pandemic, and leprosy took a backseat. But during 22 and 23, we could see there's a bounce back from these countries, all the countries across the globe. We can see that reporting has enhanced from all the countries, and the cases reported as well has increased steadily from 22 onwards. So a total of 815 cases have been reported during 2023. These are the new cases reported. So I'm also happy to inform you all that you must be aware that in 2024, it was a major milestone for WHO, where Jordan became the first country globally to be verified and acknowledged by WHO for elimination of leprosy. So with this, we also kept the theme in the WR last year that it is time for elimination and time to act. So the theme of this year's World Leprosy Day also was Unite, Act, Eliminate. So corresponding to that, we have also had 3 key messages disseminated: that leprosy is curable with early case detection, early diagnosis, as well as with MDT treatment. And the second one is leprosy is preventable with rolling out of single dose rifampicin post-exposure prophylaxis. So here I have a news to share with all of you that Novartis has come forward and is supporting the expansion rollout of single dose rifampicin across 42 countries during this year. And we have already got the orders given to the 3 major pharmaceuticals, and we're expect to get the single dose rifampicin into the 42 countries across the globe by September this year. And the third one is to increase the community awareness and participation of persons affected by leprosy, which helps in mitigating stigma and discrimination. So under this 3 key points, we are interesting the countries to act on this. Thank you. Next, the major one is the new digital tools which GLP has implemented. As you all know, that the first one is a global aggregated system based on the DHIS2 platform. DHIS2 is a district health information system, which WHO has adopted. And we are using this annual aggregated data system to compile all the information from the countries on an annual basis. This is aggregated data every year, and we have started the system from 2016. Till last year, we were only using it for the aggregated system, but now in this year, we started adding into the DHI system two more things. That is the leprosy case-based management monitoring system, as well as a leprosy elimination monitoring tool. And the last one, the LPTA, that is still work is in progress. I'll be sharing the snapshot of this. So this leprosy data from the countries are obtained, and it's a Excel sheet which we used to send it to Euro countries. But yesterday we have sent it for 2024 data compilation for all the regions and the countries. We have requested, especially Euro region, where earlier we used to send the abridged Excel sheet. Now we are also sending them the DHS Excel web link also, along with the Excel sheet. So it's a countries up to the countries to respond how they want to report. And we have got the SOPs for guidance for the countries too. And it's been in the 5 languages, that is French, Spanish, Portuguese, Arabic, and Russian. So to enable the countries to go through these guidelines, and we provide handholding support to them if they have any issues of data entry. We support them, and we make sure that the data is obtained and it's entered by all the countries by 30th of June every year. We also given this year also for 30th June, but some countries may send it later. But that's how the compilation starts, and we try to analyze and then publish it in the weekly epidemiological report. Now coming to the leprosy case-based management monitoring system. Here, this is an individual level app where right from the registration of individual leprosy patient, the data has been entered into through this app, it has been entered. So this helps the countries to document all the leprosy reported cases, and also documents all the events thereafter, right from the diagnosis, treatment initiation, and how events of reactions happen, that is also documented, and whether the person has been, some patients from other areas, they'll be transferred in or transferred out. So those documents will be also done, whether the patient is on treatment, continuity of treatment, or if there's any default issue, that will be looked at. And also for the manager level higher up, they can also look at the drug stocks based on the cases being treated there at the subnational level. So overall, this monitoring tool, we have took nearly 2 years to develop, and we had just gone through a rigorous process where we had a lot of consultations. And finally, this document has been published on the website. And presently, we have 3 countries who are piloting this website. And we can also customize this tool on the DHIS2 based on the country needs, based on the consultation. So we have already provided this information to them, and we'll be supporting the countries to modify if any requirements locally. So this app has got the following data entries to be done. That is the case registration, and the following that we have a module on clinical information and treatment initiation, and case management and follow-up information is also there in the next module. And we have also introduced the contact tracing and SDR provision also. So that will also help the countries to track the patients and the contacts based on the index cases, and the reaction management, including the drug dosage, everything. And finally, the treatment outcome is also captured. So in this way, it will be useful for the countries to enter the cases instead of paper-based. We also want to encourage the countries to have a very efficient way they can try to put this into the digital systems, and help them to have the quality data and to monitor and to also handle the logistics part. So we have also piloted this app in 2 of the NGO clinics, and we know that it takes less than 15 minutes for each data entry. So this has also got approval from our tag, and this has now been implemented. As you're all aware that the technical guidance on interruption of transmission and elimination of leprosy disease and its accompanying documents, namely the Leprosy Elimination Monitoring Tool, Leprosy Program Transmission Assessment, have been released during the middle of 2023. So during the last year, I think December, we have also updated and uploaded the elimination dossier also, so that countries can use that dossier information whoever is going towards elimination of leprosy. So these accompanying documents, if being done individually at the country level, because the data has to be captured at a subnational level upwards. And we know that initially we had this as a separate tool, but now integrating into DHIS2, it helps the countries to have the data done at a very faster pace, and it's a cost efficient with countries able to monitor themselves to see where they are. So the DHIS tool helps to monitor the progress through the phases of elimination at national level, with the data being entered subnationally. And we also make sure that this entry, we are providing a handholding support to start with initially, where an Excel sheet, we share it with the countries, and once they give this Excel sheet, that will be uploaded into the DHIS system platform. And here, once the information is available with the shape files and the country codes for subnational level, then we provide this information to the countries so that the countries can manage themselves with their own username, password, and so that the data security is there, and they will be able to update the information prospectively at the subnational level, and they can track the progress where they are. So this is how WHO GLP wants to support the countries through LEMT integration into DHIS2. So I can just take you through one of the demo in this link. So I was just talking about once you get into this web link and we choose Afro region. Sorry. Yeah, I've just opened in Afro region Benin. So they have given data from 2006 onwards, and the data is updated up to 23. I just had to press submit here. Then we can get the LEMT displayed here. And this can also be further downloaded. We have a Excel option as well as PDF option. If you want, you can look at the Excel option here. Yeah, this just takes in a fraction of seconds. This can be opened up. Now, moving to Leprosy Elimination Monitoring Tool. Again, I choose Afro, Benin, generate report. And again, we know that it is from 2006 to 2023. And we have an options of intervals choosing 3 years, 5 years, 7 years, and 10 years. I will choose 7 years for our demo now. So we have this serial maps starting at the intervals of 7 years, 2009, 16, 23. So this can also be downloaded. The PDF option is there for downloading. And the last one is a summary tool. Again, I'll go with Benin. Here we have introduced some analytics into this. So that if you look at the LEMT tool, we can't find out individual at the subnational level where the last case was reported. So this acts as a ready reckoner for us. So we know, like at the subnational level, which are in which phases and how many cases were reported in each of these phases at the subnational level. And again, in the subnational level, the sporadic autochthonous adult cases, when was it reported, which years it reported, and which was the district. Similarly, sporadic autochthonous child cases, when was the last case reported and which was the district. So this kind of summary we get by using this. So this will help the national program managers as well as the policymakers at the country level to identify and see the progress they are. And it also enables, because this will also be useful for the internal verification tool. And also when the country is submitting the dossier, this LEMT information will also be useful for the external review purpose. Now I'll stop this and I'll come back to the presentation. So now I'm going to talk about this Leprosy Program Transmission Assessment tool. This is a tool which is also useful for the internal verification as part of the elimination review. So this will be carried out at the national level, at the subnational level also, where it will capture all the relevant information required for the program, leprosy program review activity at the subnational level. So under the three broader heads of political commitment, program implementation, and surveillance, and to see whether the milestone as of this has been achieved or not. That will be useful during the verification process later. So all the program components under the three broader heads will be captured. But again, this is a laborious process. To make life simple and user-friendly, a tool is made available on the DHIS2. So where leprosy program managers can assess the status of the program and related leprosy services. And the health ministry, they can also look at which subnational level has achieved the progress of interruption of transmission and which are nearer to that. And this information, once it's compiled, it will also be useful for the leprosy dossier to be submitted to WHO. And for WHO, these tools will be used for the final verification at the site. So this is a process which is done within the country and to the national level and the national level to WHO. And it will all be the same, and it will be documented, and it will be available on the DHIS2. So this may take at least a couple of months more for us to publish it. So this is in brief about the digital tools with GLP as this is still under work in progress, whereas other tools have already been published and it's been piloted in the countries. Now I want to give a snapshot. Yeah, this is how the tool looks like, because it's already pre-populated to all the information. And the white box is where at the subnational levels, they had to just put up the type the findings. And we're also providing the level of achievement as a drop-down box, so that there at the field level also it's user friendly for them to look at what are the things to be looked at and to state where they are. And also they can write remarks if they want to put up anything in this. So now coming to the development of guidelines, as you are aware, this is information is purely a WHO activity and it's a restricted information. So I'll just give the overview of what has happened during the development of the guidelines in 2016 onwards for the guidelines, technical guidance, which was developed on the diagnosis, treatment, and prevention. So the committee was formed. Before that committee, there was a background document which was prepared. What was the rationale for giving us the rationale, who are the target audience, and the goals and objectives. And this guideline review committee then forms the contributors and guideline development things. In that first one, there's a WHO steering committee, which will be formed, which has got expertise in the areas of intellectual property, evaluation of essential medicines, management of HIV co-infection, gender equity, and human rights. So these are the internal WHO team who looks into this document and they will further try to select the guidelines development group. This is called GDG. So which is across the regions, which they look at experts in the civil society area, then the academia, then we also have the Ministry of Health engagement, as well as the health economists, and also the methodologist who supports in all these things. So this is done in a participatory manner, and people are invited for this committee, and they will be this review committee will be finalized by the overall guideline review committee. Then once this committee has been done, then the background literature review has been carried out, and the external partners to this GDG, that is example for the diagnosis, treatment, and prevention, we have invited Sasakawa Health Foundation as well as Novartis, because they're the drug donor support for MDT, and any changes in the treatment, they should also be informed, and according changes has to be done in future. So keeping that in mind, external partners to the GDG were also involved in this. Then the systemic review committee, they started looking at the review of the literature and then presented to the GDG. And the methodologists supported us using the grading method to look at all the evidences and with recommendations. So the grading was done based on the evidences generated and what was suitable. And we also had consultation with external partners like ILEP. So ILEP also, along with its member organizations, they also looked into the recommendations, gave their feedback, and again, GDG makes sure that there's no conflict of interest of the members who have been taken on board for any of these activities. Then, based on the PICO questions formed, the methodologist looks at all the recommendations and grades them accordingly, and then final set of recommendations, guidelines development stats, and that is also will be piloted, and based on the feedback, the final document along with all the references will be finalized and disseminated. And again, how it will be disseminated also, this committee gives the guidance how to go about it. But it is a tedious process, labor intensive, and compiles pools up all the expertise in the field, and it has also a lot of resources are required to carry out all these activities in this process. So this is how the guidelines have been done. And presently, we are looking at a revision. So already the PICO questions have been identified, and the internal committee is looking at the evidences. Are there any sufficient evidences to take this forward? So we are in the middle of this process. So this is the information as of now. Thank you. And I'll be happy to answer any of your questions.
Yes, thank you very much, Doctor. We are spanning, well, we have some 50 countries, registrants from 50 countries, and we're spanning multiple time zones. And so we really want to try to stay on track here. We do have time for one question, which was submitted in the chat, and that would be, which countries will be piloting the LCBMS?
Okay, so normally what happens is we ask all our regional entity focal points, whoever is willing. So we would like to take it up for piloting in each of the regions, and based on that, we will do the piloting, and then based on what the entity focal points gives the feedback, we do the piloting, and then accordingly we'll take it forward. Presently, the countries which have shown interest is Nepal, Tanzania, Comoros.
Excellent, thank you very much. One other question that was out there was the data within this database a global database? Is it open to all countries, any user, or can you only access your own, say, country's data?
Yeah, only the countries can access their own data, because it's a data safety and security, and we don't want others to intervene. Only WHO for the compilation analysis, we have the overall look into all the data, but at the country level, it's only for the specific country.
Thank you very much. So I've pushed it as far as we can possibly go. we need to allow users to log on to the, or to move to the other A and B track for the remaining sessions as we come through here. I thank you very much for your time and effort here. We
It's a
appreciate,
pleasure. Thank you.
we
And
appreciate the news too about Novartis
thanks.
and this database development altogether. So to all the other users out there, I invite you to please pick your A or B track or A and B track, move between them, and we thank you for attending so far. Bye.
Thank you.